Hello there. Welcome to my show. COVID-19 update by Heerak for October 11th, 2020. You're listening to music from Argentina in South America. And in America, we are celebrating Southern Food Heritage Day. As you know, Kentucky Fried Chicken, Louisiana Popeye Chicken, they're all Southern cuisine. And who doesn't like fried chicken, right? Um, yeah, so have fried chicken today from Kentucky or Popeyes or another great Southern food cooking venue. There are charbroiled chicken from South America as well. I mean, you can find them in Columbia Pike in Arlington, Virginia. And they're from like South America or Central America. Yeah, chicken is loved all over the world. Um, Korea has chicken soup, and you make that whole chicken soup with ginger and Korean spices, and then you stuff the chicken with rice, and then you eat that. It's like a stew. You eat that with soy sauce and some Asian onions. Um, and it's really good. It's really good. Yeah, if you go to a Korean restaurant, you could ask them for like, ask for whole chicken prepared in a stew, and some restaurants will have it, and you go to Korean restaurants in Arlington, Falls Church, Fairfax County, Alexandria, and try it out. You may love it. Yeah, it's, things are different now because of COVID-19, right? Georgetown University is completely closed to undergraduate students and graduate students. And it's the smart move because a lot of people are getting infected in colleges. And we are heading into 6 months of flu season. And a lot of people are going to die during the flu season, especially in open schools and open colleges, professors, staff, students, nearby neighborhoods. So Georgetown University made the right public health decision to close down Georgetown University to undergraduate students and graduate students. And as you know, Heerak Christian Kim, that's who I am, independent candidate for U.S. Congress in Virginia's 8th District. I worked 3 long months to ensure that Georgetown University closes for 2019 to 2020, or actually 2020 to 2021 academic year. Um, Georgetown was originally going to open with all the first year undergraduate students coming on campus and seniors on campus, um, and then some other students. And they were going to have graduate students on campus. And I'm like, no way. We don't want people to die. We don't want Hoyas to die, Georgetown Hoyas, to die from COVID-19. This is a global pandemic that's killing a lot of people. It's killing like 1,000 per day in America, and we're just entering the flu season. And we have 569 people who've died from COVID-19 in the less than 24 hours. Seems I'm recording this a little bit earlier today than yesterday. And also it's Sunday, so numbers kind of arrived late. So I'm sure it's going to be over 1,000 in the 24-hour period from yesterday's show. Or, certainly the numbers are maybe trickling in later, but the actual numbers are over 1,000 for sure. COVID-19 is killing a lot of people. It's infecting a lot of people. But Sundays are holidays in America, and holidays are sacred, to Americans. So the reporting doesn't always come on time. Um, yeah. Um, yeah, a lot of people are going to church today to worship. Sunday's day of worship for a majority of Americans. Uh, over 300 million Americans are Christians, and uh, they say about 100 million to 150 million Americans go to church every Sunday. This obviously was before COVID-19, but going to church is a very important part of social life of Americans. Majority of Americans have close friends uh, from church. They socialize around church events. They volunteer at their church. They're spiritually fed and benefit from church, and they give back to church. So church life is very important. That's for Hispanic Americans, uh, African Americans, Asian Americans, whether you're Filipino, Vietnamese, Korean, Chinese, Taiwanese. Uh, Church is very important, to Asian Christians and Latino Christians from Mexico, Guatemala, Peru, Bolivia, Brazil. Many of them have their families revolve around their church. Latinos tend to be Catholics or evangelical. Those are the two, the strongest groups of Christians in America. Latino Christians tend to be Catholic or like Assemblies of God or Baptist, and all of them are against abortion. All of them are against gay marriage. So Latino community in America tends to be very conservative. Um, and one of the great things about Latino communities is that they marry young, which is a smart move. You're most fertile for children at around 18 to 20, 26. You go over 30, you can have pregnancy complications. You may not be able to have a child. Um, so your ability to have children goes significantly down after 30. And a lot of people get you know, uh, therapy to get pregnant, and some fail. So you want to get married between 18 to 20, 24 or 26 if you want healthy children, and if you want to get pregnant and have, if you want like two, three children or more, you want to definitely get married around 18 to 22, 23. Um, Younger you're married, more children you can have, healthier your children will be because your eggs get old with you, right? So women are born with all the eggs that will have throughout their entire life. So at age 18, your eggs are 18 years old. Obviously, the longer you wait, eggs start getting worse. Your body slows down, right? After 24. You start gaining weight after 24. You may start developing like diseases after 26. So if you develop diabetes, the chance that your child will have a diabetes is very high. So it's better to have your child before you develop health complications, because once you have health complications, you will pass these things on to your children. It's better to have children when you're like 18, 19, 20, 21, 22, 23, rather than have children after you have health conditions, which you will pass on to your children through your DNA. Um, but your DNA can get modified, right? Um, you're born with certain traits, gene traits, but throughout your life, based on what you do, whether you smoke, you eat too much, you drink too much, your body changes, and those changes can pass down to your baby. And that's why it's best to have your babies when you are young, like 18 to 26. That's the best. You give your babies the best chance of being healthy and successful physically and health wise, and so yeah, so if you're a woman and you're interested in having a beautiful and healthy children, you should focus on trying to find someone to marry from 18 to 22 to 24. Obviously, the best thing to marry, best person to marry is the first love of your life, because it's all downhill from there. Generally, it's all downhill from your first love, your first true love. And most people experience their first true love in high school. Some do not experience it in high school, but they experience their first true love in college. You should marry your first true love. Generally, generally your first long-term relationship is your first true love, right? Um, yeah, so that's something that uh, you wanna do, and also obviously one of the things that today's Sunday and people go to church, and Southern Baptist Church says you should be virgin before you're married. Assemblies of God says you should be virgin before you're married. Catholic Church obviously venerates Saint Mary, Mother of God, and she gave birth to Jesus, who's God, so she is Mother of God. And she was virgin, right, when she gave birth to Jesus. So virginity is very important in Christianity, and it's sign of purity, right? And so you know, and men respect virgins, and that's the way men are. That's the way men have been. And men are generally nice to women until they give sex. Right after they give sex, they become like, they don't treat you with respect. I mean, that's bad, but that's how guys are, right? And that's why they have the song "Will You Respect Me in the Morning?" Because once man has sex with a woman, it's like he conquered her. So you give in to his advances. So you've raised your white flag, right? That's what it means on a social sexual terms, right? So men respect women, who get them to marry because, in a sense, once you force, but if the guy is willing to marry you, then he is submitting to you, right? To be married. So he recognizes whooped by the woman. And that's why, men of all education levels, all races, all work conditions, whether they're blue collar, labor intensive work, or white collar jobs, they all recognize like the wife is like, they've been rough, So when they're with boys, and if the wife calls and tells them to come home, they'll be like, my wife wants me to come home. They go home, generally, so they're wolves, and so that's only way a woman can dominate a man really is through marriage, right? Because a man can walk away anytime if they're not married, and they don't lose nothing. I mean, if you're married and the man walks away, you get 50% of everything he has. But if you're not married, I mean, you're a loser, right? He can just walk away and find a more beautiful woman, you know, um, more younger woman, and you get nothing for years of having sex with him. You you gave him sex for free. I mean, that's for 2 years, and you wasted your life on a guy who's never gonna see you again. You know, most likely after the 2 years. So you don't want to be stupid. If you're a woman, you should not give the guy sex until you have the wedding ring, because if the guy truly loves you, then he will wait to have sex with you until marriage. And if you give him sex before marriage, then he's not going to respect you anymore because you gave in to his sexual advances and you had sex with him. He's not going to respect you. It's just the way guys are. It's like 100% of the guys are that way. Um, it doesn't matter what their education level. It doesn't matter what race. Um, it doesn't matter what social class they are or what kind of work they do. Guys are guys. Um, so if you're a girl, you should not give into sex you know if you want to have a happy romance life, happy marriage life. If you want the guy that you love, um, you need to know whether he loves you back, right? And you do that by withholding sex until marriage. If he loves you, then he will marry you. If not, then he'll walk away. Then right? You know that he doesn't love you. Um, Guys are lazy, right? Guy's gonna stay with a girl that he could have free sex with until he finds a prettier woman. If he's not marrying you after 2 years, he's probably not in love with you. You know what I'm saying? Guys marry the woman that they are madly in love with. They don't just hang around the woman. That's just like there are exceptions to the rule, but exceptions prove the rule. Guys want to quote possess woman that he he loves. He doesn't want to lose her, so he'll try to marry her. Um, Be smart in life. If you're stupid, you're not going to be happy in life. If you're stupid, you're not going to be happy in romance. If you're stupid, you're not going to be happy in marriage, right? I mean, you got to remember, a woman is most fertile from 18 to 24, 25. That's when you want to get married, right? A smart woman understands science, right? I mean, you want to like recycle and you want to save species, but you're not going to save yourself. You need to respect the science, biology, and what goes on in your body. You cannot change that. You have from 18 to 25 to be like most fertile. Uh, you don't want to miss that window, because if you miss that window, you're basically a spinster. You're like a loser, you know. I mean, if you can get married during your most beautiful stage of your life, 18 to 24, I mean, geez, what chance do you have after that, right? Yeah, don't miss your window of 18 to 24, the most beautiful time in your life to get married. Because you could always do stuff after you're married. There are a lot of people who do nursing school, um, second degree nursing after they're married, and they're very successful. There are a lot of people who do like master's degrees, law degrees while they're married. They're very successful. You should, there are a lot of people who get married in medical school, like second year in medical school. They're very successful and happy. So they can have it all. I mean, don't be a loser and not get married before 26. Um, yeah, I mean, you gotta respect the science, and part of the science relates to you and your biological processes and your body. You don't want to lose out on your own happiness because you're saving this, you're recycling stuff, and you're trying to save the endangered species. You let your body like degenerate, and before you know it, you're like an old spinster, like after 26. You're not married, you don't have children, you're gaining weight because after 26, your metabolism slows down. You start gaining weight. The same kind of exercise you do will not keep your weight down. Um, that's just the way things are. After 26, your body just goes downhill from there. I mean, that's just, you can't avoid it. So yeah, be a smart woman, and try to marry between 18 to 24. Marry the first true love. That's the smart move. Don't be dumb, because you make happiness for yourself, right? If you let your first love go, it's all downhill from there. You're not going to have any love after first love that's going to be greater than first love, except for a few exceptions. I mean, I'm a historian. I study history for history of thousands of years, and that's generally true. In throughout history. Um, human nature is human nature. Human experience is similar. Um, yeah. You know, uh, so we have 569 COVID-19 deaths in the last, less than 24 hours, but in a day or so, and the death figures are at 214,573. Confirmed cases are 7,729,108. Um, and you know, uh, Latin America is unfortunately becoming a continent of death for COVID. And they had so many deaths in the summer, it's not even funny. And you know how hot it is in the summer? Have you taken a cruise to like Central America areas, Latin America areas during summer? I've taken a cruise with Ed, my best buddy Ed from Philmont Christian Academy, middle school and high school. We've taken cruises to like Caribbean in the summertime. It's unbearably hot, and with 110-degree temperatures, COVID-19 is not only surviving, it's spreading like wildfire. There's a lot of places in Latin America they don't have air conditioning in the home, and it's still spreading, right? Which shows that you don't need air conditioning, cooler temperature for COVID-19 to spread and kill, right? Like in villages in Brazil, villages in Colombia, Argentina, Peru, Mexico, you may not have air conditioning. And you may just be using a fan, which means temperature itself is like over 100, and it's spreading and killing like wildfire, which means hot temperatures do not kill. And we know cold temperatures do not kill because first flu season, when it was below freezing, COVID was spreading and killing tremendous number of people in New York. Um, so this is like an indestructible virus, it seems. And it's a 365 days a year virus. So Latin America can expect millions of deaths in the next 6 months of flu season, unfortunately. What can you do, right? God creates everything. God created tigers that eat, like, weaker animals. God created tigers. Sometimes tigers eat human beings, right? God created the world. It's a cycle of life. Some some people or some animals die and get eaten by other animals. We eat chicken, like Kentucky Fried Chicken. It's cycle of life. I love fried chicken, and many of you love fried chicken too. Southern cuisine is amazing and great. I love grits in breakfast. Um, I love going to Golden Corral, and one of the things that I miss the most about COVID-19 is not being able to go to Golden Corral and have like all you can eat grits, all you can eat like you know fried chicken with the sauce that they have in the South. Not fried chicken, that what is it, a chicken steak? Um, and all you can eat bacon and like that's what I miss the most in terms of cuisine. It's like Golden Corral is my favorite breakfast place, and I love to go to Golden Corral. And so, Old Country Buffet used to be my favorite, but I don't see Old Country Buffet too much here in Virginia. Like in Pennsylvania and Delaware, there are a lot of Old Country Buffet, and that was my favorite breakfast place. But they don't really have grits. So after I discovered grits in Virginia, like Golden Corral is my favorite breakfast place. All you can eat grits, and they're really good. They have cheese grits, regular grits. Um, yeah, if you haven't tried grits because you live in the north, you should try grits. Grits. I think that's how it's spelled. Oh, it's so good. It's so good. But unfortunately, like Golden Corral restaurant, I think they're all shut in Virginia. So yeah. Oh well. What can you do? Life is life. And it's cycle of life. COVID-19 is part of the cycle of life. And although we eat chicken, and you know, uh, we are at the top of the food chain. But little invisible COVID-19 can kill us in the millions this flu season. So that's part of cycle of life that God has created. This is part of God's creation. COVID-19 is part of God's creation, as viruses, bacteria. Unfortunately, it's killing a lot of people right now, like around 1,000 per day in America. But look at European, not Europe. Europe is expecting millions of deaths too, but South America is definitely going to have millions of deaths. I mean, there's no doubt about it. Um, Look at that. Brazil has broken the 150,000 barrier. It's still number one. It continues to be, or probably continues to be number one. Brazil has 5,082,637 cases, 150,198 deaths. So 3% death rate. I mean, you can have the same death rate, 3%, but if you have more cases, you have more death. I mean, just logic, right? Colombia is 3% death rate. So if they have 5 million infections, they're going to have 150,000 deaths at that rate. Unfortunately, during flu season, you're going to have far more die because death rate spikes up, generally from 3% to 10%, or maybe even 15%. It may even go up to 20, 30%. We'll see. We're only starting our 6 months flu season, and it goes all the way till May. So we're just going to have a lot of darkness and death and pain and suffering until May. Unfortunately, it's sad, but as I said, it's part of God's creation. God created the world this way. Uh, you know, um, the world is this way. And the virus are saying we're made this way. We're made this way. COVID-19 is happy now because it's spreading all over the world and dominating, right? And COVID-19 is dominating the human race right now. So on a certain level, COVID-19 is a superior species, right? When we calculate superior species in terms of ability to dominate and control, then COVID-19 is a superior species to humans right now. Life is very simple. Human history for thousands of years, recorded human history for thousands of years shows civilization that dominates is a civilization that is able to kill their enemies most effectively, right? That's what makes empires, right? Empires are created when a single nation or even like a small city like in Rome is able to kill as many people among their enemies as possible because they have a superior army, then they become an empire, right? Right? The ability to kill your enemies effectively is what makes you um, a superior nation. And like World War II, United States won against Japan because we had an advanced weapon, nuclear weapon, atom bombs that were able to kill over 100,000 people with just one bomb in each city, like Hiroshima and Nagasaki. And because we were able to kill as a nation, United States of America, because we were able to kill so many people in Japan, they surrendered to us and recognized our dominance, right? And that's why the war ended. So human civilization is about how effectively you could kill your enemies, and that's what determines your dominance. And in the modern era, they say, well, economic dominance is everything, but generally, economic dominance accompanies your ability to kill other people. You see what I'm saying? It's not like economy stands alone, right? If you have money and you live in an expensive house, you're gonna have an alarm system to protect your money, right? You may have security systems. You may have hire security companies. Uh, Millionaires and billionaires hire bodyguards to protect themselves, from being kidnapped or from being killed by their people who want their wealth. So your ability to defend yourself and to dominate, or kill your enemies if they attack you, that's an important part of economic dominance as well, right? As a nation, as a group, as an individual, and uh, so from that vantage point of how the world works, you can say that COVID-19 is the superior species to humans, at least right now on October 11, 2020, because it's killing indiscriminately and we are helpless against it. That's why I'm saying United States government must build respirators for all human beings that are like 100% foolproof against COVID-19. We don't have one. We don't have a respirator right now in America that's 100% foolproof against COVID-19. We just don't have one. We need to create one because obviously, if COVID-19 exists, then other viruses like COVID-19 can come into existence in the future and kill us too. Or most likely, virus will mutate to become more lethal. We'll have to develop more sophisticated technological equipment to protect ourselves, right? If your technology cannot keep up with a living organism or species that's attacking you, you're going to die out. And that's what happened to uh, first Americans or Indians in America. They could not develop defense against smallpox soon enough, so they died out. They could not develop defense against European weapons soon enough, so they lost the war, right? If we cannot develop respirators soon enough, it's possible for 1/3 of the world to die out from COVID in the next 10, 20 years. Um, COVID-19 is mutating constantly, so vaccines will probably not work for the next 10 years, especially because we don't know exactly what COVID-19 is. We're calling it a respiratory virus, but that's kind of it does spread through respiratory transmission primarily, but some people say it spreads through contact, indirect contact, like you touch a surface that where COVID-19 is, and then you kind of rub your eyes and you get it. Um, so we just don't know enough about COVID-19 to make definitive statements yet. And scientists don't have definitive knowledge about COVID-19. So how are you going to develop a vaccine when there's no definitive knowledge? That doesn't make sense at all. Um, but yeah, that's why I'm predicting that there will be over 100 million people in the world who will die in the next 6 months during the flu season, and that will be like every flu season, like 2001 year from now, 2021, October 11th, when flu season starts, we're gonna have another 100 million or more die 2022, October 11, when the flu season, gonna have another 100 million or more die. And obviously, COVID-19 is mutated, it could become more lethal. And this is just 365 days a year, so it's not like a flu virus. So it's forever, like HIV virus that's been here forever since we discovered it, and hepatitis C virus that's been here forever since we discovered it. And there's no vaccine for them. We were working on vaccine for decades. You hear all the time about AIDS research. How come we don't have a vaccine? Because nobody has discovered it. Yeah, nothing works. So COVID-19, I believe, will be the same, and that up to 1/3 of the world can die. So maybe after 1/3 of the world, like 2 to 3 billion people die, maybe it will go away. We don't know. It may go away. It may not. We don't know yet. But that's my long-term calculation on COVID-19 is that about 2 to 3 billion people will die in the world. Um, Americans have been dying since COVID-19 arrived here every day without stop, constantly dying every day. Why do you think it's going to go away? I mean, it doesn't make logical sense for you to think that COVID-19 is going to go away. I I march for life. I want you to live. And I don't believe in the liberal media. I don't think COVID-19 is going to go away at all. It's going to be here permanently. HIV did not go away. Hepatitis C did not go away. Why do you think COVID-19 will go away? That doesn't make logical sense. It doesn't make scientific sense that you think it's going to go away, but it's a 365 days a year virus. I'm going to miss like a lot of social events. As you know, I was the president of Georgetown Collaborative Diplomacy Initiative, which is a School of Foreign Service group at Georgetown University. I was the first non-School of Foreign Service student. I was at the School of Nursing and Health Studies, as you can see from my mask, at Georgetown. I mean, both are at Georgetown, but it's a different school within Georgetown. I'm in the nursing school. School of Foreign Service is more like political science. But I was the first School of Nursing and Health Studies students to become president of a School of Foreign Service group, which is Georgetown Collaborative Diplomacy Initiative. And I sponsored the most important and biggest Chinese New Year celebration at Georgetown University in the history of Georgetown. I do a lot to foster multiculturalism. And, hundreds of people came, and there were like hundreds of people in the wait list. Um, and it was very popular. And you can see from the photo how popular it was. And Professor Wagner, professor of diplomacy at Georgetown, prayed for us. And you see him next to the cross there. He's a Jesuit priest, and he did some missionary work in China for the Jesuits. Um, and next to Professor Wagner is George from UC Berkeley. He's in the executive board of UCLA not UCLA, UC Berkeley Alumni Association of Washington, D.C. And he helped out with the event. And next to that, it's Yang Yi from UC San Diego. And she's in executive board of UC San Diego Alumni Association of Washington, D.C. She helped out with the event. It was co-sponsored with UCLA Alumni Association, where I'm the treasurer. And you see UCLA alumni in the middle picture. I'm taking photos with them. Over 50% of the students are people of color. So that's kind of reflected in the alumni who come to our events, right? Um, and the next to that are several members of Superfood. It's a singing group at Georgetown, an amazing singing group, and they came and sang for us for this special event. And next to them are Grace Notes, which is an all-female a cappella singing group, and they're really great. They sang for us as well. It was a really fun celebration. I brought together different groups at Georgetown. That's what I do. I'm a leader. I'm a lateral leader, meaning I bring together different ethnic groups, different factions like singing groups, diplomacy experts from School of Foreign Service, uh, into a collaborative learning process of multicultural experiences. That's what I do. And at Georgetown, I did my master's in clinical nurse leader for 2 years from summer 2018 and graduated in 20 with 25, or me with 24 clinical nurse leader students. So my cohort, CNL 2020, had 25 total students. And so, we've been trained to be lateral leaders. So our primary specialty is to bring together different groups in the hospital setting to provide excellent uh, services for patients, and also make operation efficient, smooth, and cost effective, and reduce the cost in the healthcare unit in the hospital. So that's why we're trained as clinical nurse leaders. That's our primary goal, and we do evidence-based research to improve healthcare delivery at the hospital bedside level. And we do health evidence-based research to understand and provide nursing care at 3 levels: primary, secondary, tertiary. And part of that is prevention. We work within the context of public health to prevent spread of pandemics. So my creating this show on April 2nd, 2020 is part of the mission of clinical nurse leader as defined by American Association of Colleges of Nursing, AACN, which is an accrediting agency for all nursing schools in America. So in a sense, by creating this show, I'm fulfilling my role as a clinical nurse leader. And now, I'm certified as a nationally certified as clinical nurse leader. And so I speak to you as an expert of a certified expert, obviously, of healthcare. And obviously, I want to prevent death. And that's why I created the show, to provide information, provide evidence-based research, provide theories that I have that I'm working on in terms of research, working thesis, to give you guidance on how to avoid COVID-19 and survive it. So it's a healthcare service as well. And that's why, it's good for you to vote for me for U.S. Congress in Virginia's 8th District, Arlington, Alexandria, Falls Church, and Fairfax County, because I am an expert and I can save you and your children and America from COVID-19 death. Obviously, if you vote for me, I go to Congress. If you don't vote for me, I don't go to Congress. This is democracy, so you decide whether I go to Congress or not. You want me to go to Congress, I'll go and work hard for you to save your children and you and America. If not, well, then I guess I won't go to Congress. So I mean, I'm not stressed. You are the ones who vote and put people in leadership in U.S. government, right? This is a democracy, so you decide. Um, I invited a fellow congressional candidate from Maryland 2nd District, Genevieve Morris, as a honor speaker then. So she came and spoke and took questions. She was the head of VA Hospital, Veterans Affairs Hospital, Veterans Affairs, I guess healthcare system, IT sector. And she has her own company. She founded afterwards. Yeah, so she was a Republican candidate for U.S. Congress in Maryland 2nd District, which includes um, Baltimore, and I believe it includes Arundel County areas in Maryland. Um, yeah, so it was an exciting event. I tried to bring multiculturalism into my leadership, and I'm a collaborative leader. I bring together different groups and factions and individuals to work together. That's why I'll be very good in U.S. Congress, bringing together different factions to do what we need to do. For example, we need stimulus checks for all Americans, and it's being held up. Nancy Pelosi is being very selfish. She's not thinking about you and the American people. You need stimulus checks to survive COVID-19. We have 6 long months. You should have received your second stimulus check in July that President Donald Trump signed, but Nancy Pelosi is being all political and blocking that. And there are some GOP politicians who want to block your stimulus checks. Vote them out of office. We don't need people like that in a U.S. Senate or U.S. Congress, because you need your stimulus checks right now So vote people, Republicans, Democrats who are holding up your stimulus checks. I mean, that, they have no right to take money away from you like that, from you and your children. So vote Republicans and Democrats out. Vote Pelosi out. I think that would be good for America, because she's trying to block your stimulus check. Um, yeah. So Brazil is number one right now in COVID-19 death with 150,198 deaths. Colombia is number two for COVID-19 cases, 902,747. You can see cases are rising exponentially. So death rate is rising. So Colombia is gonna, it's heading in the wrong direction. So 3% death rate, 27,660. Obviously, Colombians in America are gonna die in large numbers because they have the same DNA, they eat the same food, they they have the same history. Um, yeah, so Colombians, we have a lot of Colombians in Arlington County. A lot of them are gonna die, unfortunately. Um, yeah, because you could predict who are going to die by looking at the numbers of deaths in each country, right? Because like not too many Chinese are going to die because nobody's dying in China, nobody's dying in Taiwan. So Chinese are not going to die in America in large numbers. Some will die, but not many. But a lot of Colombians are going to die. A lot of Brazilians are going to die in America because they have the same DNA, genetic makeup. Um, Argentina is 3% death rate as well. They weren't even in top five. Now they're top three. That's why I'm playing Argentinian music in the background. Argentina is an example of what you should not be as a nation. 883,882 cases, 23,581 deaths. Yeah, it's just horrific what's happening in Argentina. Death rate skyrocketed. That's what happened in many states in America. Utah may have, over 60,000, maybe over 100,000 deaths in the next 6 months. Wisconsin will most likely have over 100,000 deaths in the next 6 months. Ohio will most likely have over 100,000 deaths in the next 6 months. Yeah, Midwest is going to be like COVID-19 death zone in the flu season, and we have 6 months to go. We're just getting started. 6 months of death to go. Yeah, until May. I mean, it's going to be. You need to shut down in cities where COVID-19 is spreading. You got to shut the whole city down. That's the only way you're going to reduce the death, reduce the spread. I told you not to open up schools. I told you not to open up colleges. You didn't listen. And I warned you that COVID-19 is going to start spreading and kill a lot of people in the 6 months of flu season. I've been warning you for the last 3 months, maybe longer. You should have listened, but you still have time to reduce the death by closing everything down. That's what local governments must do. Because where COVID-19 is spreading. You must shut everything down. I know you don't want to. Who wants to shut everything down? But you have to if you want to live. Right? I mean, if there's a bear outside, you stay in the cave until the bear is gone. You come out when the bear is there. You're going to get eaten alive by the bear. I mean, geez, that's common sense. Peru has 846,088 cases, 33,223 deaths. The death rate is 4%. It's disturbing. We have a lot of Peruvians in Arlington County. If you're a Peruvian American in Arlington County, you've got to start worrying because you have the same genetic makeup. But you may not be as worried as Mexicans. Oh my gosh, if you're a Mexican American, geez, this is bad. A lot of Mexican Americans are going to die in America in the 6 months. Mexico has 814,328 cases. The death rate is 10%. For God's sake, 10%. 83,642 deaths. Yeah, it's bad. It is really bad in Mexico. If you're a Mexican American, you should worry. You should definitely worry. You have the same genetic makeup as the Mexicans in Mexico. Today's title is COVID-19 America. Is professional and college sports over due to COVID-19? What do you think? Let's read the first article. Titans closed their facility after coach tests positive for COVID-19. That's from today. by Jeremy Berman and NFL.com. This from NFL website, the official website of NFL, National Football League. The quote that is significant is, the move to close the facility comes just one day after Tennessee returned to the practice field for the first time this month following a COVID-19 outbreak among players and coaches. The facility was finally reopened after nearly 2 weeks following consecutive days of negative COVID-19 tests. The streak was broken Sunday. Tennessee initially closed its facility on September 29th after multiple players tested positive for COVID-19 following their Week 3 game against Minnesota Vikings. After more Titans players were placed on the reserve COVID-19 list throughout the week, the NFL moved their Week 4 game against the Pittsburgh Steelers to Week 7. Uh, so it's not just Titans, and you see the Titans cheerleaders dressed up in Halloween costumes. And Halloween is coming in a couple of weeks. Um, and you see Tennessee cheerleaders in their sky blue outfits. Yeah, so yeah, I mean it's cheerleaders are like the best part of football. God created women, and geez, that's God's gift to men, right? Because God created Eve for Adam. Um, so God wants you to have pleasure, but just with your wife, not with anyone else. But God created sexual pleasure, obviously, for you, for men and women, to be enjoyed within the confines of marriage. Um, yeah, and beautiful women, they're part of God's creation, just like you can see beautiful trees and beautiful cows and beautiful buildings and beautiful, there's nothing wrong with appreciating beauty, whether they're beautiful women or beautiful mountains. You know, beauty is there to be appreciated. Yeah, so just don't, you know, just make sure you don't do anything that you should not do, but appreciate the beauty. There's nothing wrong with that. Um, and underneath them, you have the New England Patriots cheerleaders, and you see next to the video rectangle that Patriots cheerleaders are working out. You have to be very fit to do cheerleading. Just like you got to be fit to do football. So when football players get COVID-19 and they're very fit, you can see like an average Joe American will definitely get COVID. Their immune system isn't strong enough to fight it off. The second article is Jason McCourty on the NFL COVID-19 protocols. They don't care. It's reported by Trevor Haas on Boston.com today. And the quote is, Patriots cornerback Jason McCourty said, it's up to the players, coaches, administration, and staff to take care of one another to make sure everyone is okay physically and mentally, because National Football League won't do that for them. I think outside of here, the people that don't have to walk in our building, whether it is the league office, whether it is the NFLPA, they don't care, McCourty said on a video call Saturday. That's one player's perspective, and many players may share that view. It's possible. Um, many nurses feel that way too. There's a nursing union, national nurses, and New York nurses. These are national. New York nurses are New York State Nurses Union. National nurses are like national nursing unions. They've been complaining since or protesting since March about conditions in hospitals that endanger nurses, right? National nurses protested conditions in MedStar Washington Hospital Center. They said the protocols put in place in MedStar Washington Hospital Center in Washington, D.C. endangers nurse lives. As you know, I'm Heerak Christian Kim. I'm predicting that minimum 12 nurses will die in every hospital in Washington, D.C. area. That's, Fairfax Hospital, Virginia Hospital Center. So, Alexandria Hospital will have 12 nurses die minimum. MedStar, Washington Hospital Center will have 12 nurses die minimum. MedStar, Georgetown University Hospital will have 12 nurses die minimum. Children's National Hospital will have 12 nurses die minimum. George Washington University Hospital will have 12 nurses die minimum. Sibley Hospital in Washington, D.C. will have 12 nurses die minimum. And that's before Christmas. Um, because, right now, we're entering 6 months of flu season and it's going to spike up. Like it's going up like this, it's going to spike up. Like straight up, like that. So, COVID-19 has mutated in April to infect babies and kill them. So if you have babies or children who get infected with COVID-19, they could die from it this flu season. So the situation is different now than it was the first flu season. The virus mutated in April in New York. And I'm calling that New York virus. And virus mutated again in Florida in June to be able to infect many 20-year-olds, and it's been doing that. And I'm calling that Florida virus. It's a mutated version of COVID-19. So, and people in their 20s have been dying from COVID. So that's going to happen to nurses as well. That's why I'm saying minimum 12 nurses will die in every hospital before Christmas. I mean, I think just that lowest kind of figure is low. I think it's going to be much more in some hospitals because virus is mutating to kill younger people. Um, and like, nurses who are new, they make mistakes, and that's part of being a rookie. Um, and so what that means is you're gonna have maybe more younger nurses die from COVID than older nurses. The older nurses are experienced. So they make little mistakes or no mistakes on them, right? Whereas young nurses who are new will make mistakes. So maybe far more younger nurses will die. Nurses in their 20s will die. But 12 nurses minimum will die in this area. That's my prediction. Um, Obviously, I don't want any nurses to die. I don't want anybody to die. But it's COVID-19. It kills. What can you do? It's that's what it is. We're entering the flu season. There's going to be a spike in death. I mean, that's unavoidable. So out of 25 clinical nurse leaders who graduated with me in 2020 August, I'm predicting at least 5 of them will die by Christmas. I mean, there are people with asthma, there are people with diabetes, there are people with uh, allergies to peanuts. Um, they're gluten free. They have allergies to like wheat products. A lot of people have immune compromised systems that could die. And they may have pre-existing conditions of other conditions, or if they're fat, that they're puts you at high risk for death. So yes, I want to go cheer for my clinical nurse leader cohort members. I love you guys. CNL 2020, CNL 2020. Yay, we did it. We graduated from Georgetown University with our master's in clinical nurse leader. Some of us may die before Christmas 2020, but you can put on your tombstone, graduated as Hoya 2020 August, CNL 2020. Yay. Yeah, I'm not going to say no one's going to die because that's just not like lying to people. There's a really high chance a lot of people are going to die. There's no reason to lie to people. And that's what I don't like about the liberal media. They make it sound like there's no problem. What do you mean there's no problem? 1,000 people on average are dying every day in the summer. In the winter, you can have 10,000 people, 20,000 people die per day in America alone. I mean, it's the flu season. Yeah, it's coming. I mean, we have until May. 6 long months of COVID-19 deaths. 6 long months. People are going to die left and right. Hospitals will probably fill up by October. And then you have 5 more months of death. That's why you're going to have 12 minimum nurses die by Christmas. These hospitals will fill up probably like by October, November, after Halloween. You're going to have all these people getting infected and trick-or-treating, Halloween parties, and hospitals will be overflowing. There won't be any room in hospital. There'll be like patients in the hallways, as we saw in New York hospitals in April 2020. And that's like just in November. We have like over a month to go to Christmas. Yeah, that's why minimum nurses will die in every hospital. That's coming. I think it's a rational uh, prediction based on science, based on what we saw in 1 month in April, and based on the fact that now it infects 20-year-olds and kills 20-year-olds. Um, yeah, I mean, it's going to be horrific season. Yeah, it's going to be bad. Um, yeah. Anyway, I hope you will be safe. Don't go to any Halloween parties. Don't take your children to trick or treating, right? I mean, geez, I mean, if there's a bear outside a cave, you don't just walk out. You know what I'm saying? Because the bear is not going to be saying, "Oh, please go by, go by." I'm just going to watch you go by. No, COVID-19 is not going to let you go by. Yeah, if you go outside the cave, bear's going to trample on you and eat you. Just like COVID-19, it's not going to just let you go by without infecting you. You know what I'm saying? And your children. So play it safe this Halloween. Don't go trick or treating, and don't go to Halloween parties. I mean, just be smart. You have until May. I mean, see, Halloween is just October 31st. You have until May. If you're not careful until May, the bear is going to be outside until like May, end of May, or like mid-May. You better stay inside the cave until mid-May if you want to survive this thing. Um, yeah. As you know, I created this show, COVID-19 Update by Heerak. It's a daily show to save you and your children from COVID-19. So check back tomorrow for more helpful information on how to survive COVID. I look forward to seeing you tomorrow. Bye.